We as physicians bear witness to our health system's injustices. The struggles and consequences of lacking health insurance fall particularly hard on minority communities. 21% of African Americans and 33% of Latinos are uninsured, significantly higher percentages than that of the general population. There are some who see these trends as collateral damage from insurance companies doing complex management of risk or moral hazard. In reality, it doesn't take an MD to see our health insurance system is simply morally bankrupt. Over 40 years ago, Dr. Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Sadly, this nightmare is still going on today. For those who are unmoved by the moral argument to address minority health disparities, let's talk dollars and cents. The Joint Center for Political and Economic Studies published a report last month that found the combined direct and indirect costs of health disparities and premature death between 2003 and 2006 to equal $1.24 trillion. I know big numbers are thrown around loosely these days, so let me try and repeat that slowly. The total economic burden of health disparities just between 2003 and 2006 was $1.24 trillion. The inequities of our health system pose a very dangerous future for America as we become a minority-majority country. H.R. 3200 and the Senate Health Bill have several provisions that will help the public health and medical communities better serve minority communities. Eliminating discrimination on pre-existing conditions, funding community health centers, and supporting cost-effectiveness research are all valuable steps in the right direction. However, these provisions by themselves do not address unequal access to care. All of our patients need to be able to see the doctor when they need one. A public option will open the door to healthcare for minority communities where many of them are having that door slammed in their faces by health insurance companies. We know the public option debate poses opportunities and challenges for all of us. There is a lot of concern over how to build it, how to finance it, and whether it will accomplish its goals. But doctors are no strangers to fear, uncertainty, and hardship. I have told parents that their children have heart defects or leukemia. I have told them that the surgeries and chemotherapy their child must endure will be very challenging. But at the end of the day, these treatments will save lives. Most importantly, I empathize with these families' fear, and I always assure them that I will be by their side every step of the way. Today, we as doctors make that same pledge for health reform and the public option, to be by the side of our fellow Americans. There are some tough decisions to make, but delay and inaction are not among them. Medical organizations and health professionals are putting aside our differences and have come together to say it's time to put patients before politics. We support meaningful, comprehensive health reform, including a public option this year. Our patients cannot wait any longer. Thank you.